This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
You know those tasks you know you have to get done, but you just don't have any time, so you find yourself putting them off. The first thing that comes to mind, those health screenings that can give you a heads up on any potential problems.
Well, today we're going to talk about skin cancer screenings, and while you might think, that's not something I got to worry about, my skin's just fine, thank you very much. Well, consider this. Studies show more people are diagnosed with skin cancer each year than all other cancers combined.
Wow. So what do you say we take care of that skin cancer screening, and better yet, it won't cost you a dime. Haley Weingartz is a hospitalist and inpatient provider at PRMC. Thank you so much for being here this afternoon. Let's start with those numbers. Skin cancer is the most frequently diagnosed of all cancers.
Yes, it is. So skin cancer is actually the 5th most common cancer. And the concerning thing is that the prevalence is actually increasing. So there's 3 different types that we're worried about. Basal cell is the most commonly diagnosed, followed by squamous cell, and then melanoma, which is the really worrisome type of skin cancer because it is fairly aggressive and can metastasize. So skin cancer screenings are very important to make sure that we detect these early and people get treated.
So I have heard that people on Delmarva have a higher risk.
Yes.
Really?
They do, yeah. It's actually, I think when you look at the national average, we're actually 2 times greater than the national average in regards to diagnosis of melanoma. I think at PRMC in general, 11% of the cancers treated at PRMC are melanoma in regards to, like, the national average, I think, is 5%.
My goodness.
So, yeah, so I think it's a combination of things. Lifestyle, we're, close to the shore, so there's lots of water activities. People are frequently out in the sun. And then the other thing is there's a genetic factor when we talk about melanoma in particular. So Eastern European descent, we tend to be lighter skinned. So that fair skin tone, the blonde hair, red hair, and blue eyes put you at greater risk for developing these things.
And usually there are signs or symptoms. Obviously, if you get a screening, it's gonna be noticed. But is there anything that, like, I could notice before I get a screening that may indicate I have melanoma?
Yeah. So, I mean, annual skin exams are great with your provider, but you can also do a skin exam with. We kind of follow the ABCDEs of a skin exam. So when you're looking at lesions on your body, is it asymmetric? Are the borders irregular? You look at any color variation, the diameter. Anything greater than 6 millimeters is a bit worrisome. And then any evolution, so any changes. If you notice something that kind of looks irregular, out of the norm, different from other things that you have, we tend to use like the ugly duckling rule. So if it just kind of stands out to you and you notice it changing in size, bleeding, ulcerating, those are kind of warning signs that you should definitely see a provider.
And you're not just talking people who bask in the sunshine.
Everybody. Yep. So anybody. It's skin cancer is not just lifetime exposure to UV radiation, but also intermittent, intense, prolonged exposure. So a lot of people tend to think, oh, I'm covered with an SPF with a sunscreen, I can bask out in the sun for hours and I'm fine. But that's not really the case.
But sunscreen is important.
Yes, sunscreen is very important. So, in regards to protecting your skin, you should also wear clothing. So protective sun garments, long sleeve shirts, hats, wide brimmed hats. Sunglasses are also very important. And then SPF, so sunscreens are a vital,
Yeah, protect yourself as much as you can.
Yeah, and reapply. That's where I always get it, is when I forget to reapply.
Yes, it's recommended that you put it on 30 minutes before you go out in the sun, and that you reapply if you sweat or if you go in the water. So.
All right, so let's talk about free skin cancer screenings.
Yes.
You got something coming up.
Yes, so we do. With the Richard A. Hansen Cancer Center, we're doing a free skin cancer screening.
It's going to be Monday?
It's going to be on Monday, May 6th from 4:30 to 6:30. It's going to be myself and Dr. Sims, as a dermatologist in this area. We'll be providing free skin cancer checks.
And we need to make an appointment.
Yes, you need to make an appointment.
All right, so there's your number, 410-543-7006.
And
Yep.
what does it entail? I mean, it's not invasive by any means, is it?
No, so essentially we're on a kind of a wellness van, and we have 2 separate patient examination rooms. So we see the patient one-on-one, we do a full body skin exam. If we see anything worrisome that we think warrants referring them out to like a dermatologist or a plastic surgeon, we can do so, and then the patient can actually make an appointment and to see if it, you know, needs to have an excisional biopsy or punch biopsy for further examination.
All right.
Yeah.
Thank you so much.
Yeah, thank you.
Dr.
Thanks for
Weingarts
having
with
me.
PRMC.
Thank you.